Welcome to Socializing Security, where every week we have a discussion about security, compliance, and beyond.
Our goal is to learn and grow by socializing each week's topic with each other, our guests, and with you.
A quick compliance note, this podcast is meant for informational purposes only and should not be considered legal or regulatory advice.
We're glad you've joined us, and we hope you'll learn along with us. And we're back with another episode of Socializing Security. We're here to continue a conversation with Jon Edwards that we started last week with you all. So we'll finish that this week.
So for those of you that didn't tune into last week's episode, we have an individual. His name is Jon Edwards. He's joining us to talk about the kind of his ethos around cybersecurity and the importance for securing healthcare systems, given his current role as the head of engineering, infrastructure engineering for a hospital system. We decided to, he was gracious enough to give us so much of his time that we were able to record 2 episodes in this session. So the first episode was we were shining a light on some of the security aspects that he deals with, in his day-to-day job. And now we're really pivoting to compliance. And so y'all know this is my usual favorite part of the conversation. But, happy to wear both hats, but I'm really excited to just kick off the conversation with kind of a cliffhanger we had last week. So if you didn't tune into that episode, go listen to that one first,
yes.
And then don't skip ahead because my goodness, Jon is just incredible. And so I'm very grateful that he was so gracious to give us so much of his time.
Yep. So if you haven't listened to the first of this 2-parter, as soon as I'm done saying this, hit pause, go down into the episode notes and hit the link and watch or listen to that episode, and then come back and we'll bring Jon on now so that you can hear the rest. And we're back with Jon. Milou, why don't you pick us up right where we left on the last part?
Yeah, so we are getting ready to hear Jon's answer to just kind of a wild scenario, and I'll give a really short recap. But if you haven't listened to part 1 of this particular episode, please go back and just go and listen to that one first, because it was an incredible conversation about security and healthcare. And now we're really going to pivot and talking more about the complementary, regulatory compliance friend side of the conversation. But to kick it off, I yesterday had a friend reach out to me, basically his, not even his manager, but somebody in the sales side just showed up and was like, hey, you're now expected to beta test this wearable AI technology. And he happened to just reach out to me to being like, hey, have you ever heard of this? And I was quickly vetting it because my initial reaction was, heck no. I would have said, no, thank you. But he was not in a position to opt out because it was really he's the one that's, has to test it so that it rolls out or doesn't for his team. So he's doing what I would like to say is actually testing the thing. And hopefully he was like, how can I say no to this? And so he was politely asking from a compliance and legal perspective of hey, as an employee, and I think in the healthcare side specifically, this to me is such a risk from a malpractice, because I have clients come to me, they tell me these wild things in the healthcare side of what they want to use AI for. And I'm like, whoa, as a risk officer, the worst case scenario here is you're going to jail. Not even negligence and malpractice, you'll lose your license. But some of the stuff I'm hearing, I'm like, whoa, you make a mistake and it's recorded and it's on video and it's, actually an AI tool is actually trained on it. You're going to jail. It's not even, it's criminal liability will kick in. And so that's what I love about healthcare. And that's why I absolutely love representing compliance, needs for healthcare clients, because it's so real for all of us. We can all understand the worst case scenario here, but Jon, I have to hear your feedback on what would you think if somebody, it's shadow IT, it's already been pulled into the system without clearly properly being vetted. It's my favorite scenario when a sales officer is the one that's pushing IT change. I was like, oh, that's a red flag right away. But yeah, how would you handle that from your side?
All right. So I'm going to step back for a moment, because the situation you described, there are only 2 groups, in my opinion, that should or would wear a wearable with AI to track that out. One is the development team, because they're trying to vet their product and determine what it does and doesn't do well, or voluntary beta testers that choose to put themselves in a position and sign away their rights and privacy. Those are the only 2 groups. If I'm an employee and they say, we want you to wear this shock collar that's going to tell us where you're at, and when you step outside of the line The AI will determine whether or not it was accidental or intentional and will shock you. I'm giving them a 2-word response. The second one is either off or you. We all can kind of figure that one out. But more broadly, AI today scares the hell out of me. And it scares the hell out of me, not just based on the potential of what it can do, right? Skynet, I get it. It's coming. Death will be quick. I won't have to care, whatever. But everybody is trying to capitalize and monetize AI because it is the thing right now. And yes, we've seen a rapid evolution. We're going to continue to see a rapid evolution in technology. Not new, not surprising. But everybody is saying, we have this product. It's got AI. You need it because it'll solve X, Y, and Z. Yeah, but they don't even know what they're doing. And the reality is they are trying to get their products to market to use customer data or PHI or whatever they can to make their products better. They are relying on cycles upon cycles upon cycles, and people overlooking the privacy aspect or the personal risk aspect because this is the new shiny rock that's going to, again, solve X, Y, and Z. So I have a lot of heartburn just in general when it comes to people bringing product. And I've seen an example where AI laden products have made a positive difference in healthcare. I'll give the example. When someone goes in for an MRI, back in the old days, it used to take 45 minutes to an hour for a scan. You're in the claustrophobic tube, praying for a quick and merciful death, and listening to the magnet take away your hearing. Today, and one company in particular that I've worked with, they've rolled out software augmented that has sped up MRI scans by 35%. I just had an MRI on my hip, and something that would have taken 50 minutes took 27 minutes total. So again, yeah, there are great examples of where it works, but that's like 1%. The other 99% is let's throw it at the wall. Let's see what sticks. Let's see what doesn't get us sued. Let's go that direction. Now, to your comment about the hypothetical of somebody comes into the hospital system and says, hey, this is neat. We want you to wear it to track your information. Whether I'm a patient or in my current role on infrastructure, the response is still that 2-word, the second word being off or you, right? Because it's such a new space and the guardrails aren't clear from my perspective. I think from a technology perspective, we have a long way to go to ensure proper governance and proper guardrails of how AI can be responsibly used. And I think it's moving faster than, and I will sidestep, I'm the last person in the world that'll ever be for big government. Like I'm maybe not the last, but second to last. So when government regulation gets involved, I'm like, eh. But this is one of those
This one.
situations. Yeah, but this is one of those situations where I'm like, I'm actually okay with it. So technology is moving
We're
a
on the
lot
same
faster
page
than-
for that.
Good. We're good. The fact that the technology is moving so much quicker than government can pivot and help provide those guardrails gives me a little bit of pause. So my guidance would always be that's a no, and you should always say no. And it's up to us as a hospital system, if we're doing that, the onus is on us to prove to the patient or the employee, we know we have full command over what is collecting, how the data is being collected, what the remediation steps if something bad happens. And here's a card for a lawyer to sue us if we screw up. If we are unwilling to do that, we shouldn't be willing to deploy the technology. We have to own, not just the system I work in, but in general, any kind of organization, healthcare or otherwise, that's willing to put that out there needs to be willing to own the consequence and not throw your hands up and say, well, we didn't think that could happen. Well, then we shouldn't have tried to deploy it until we've vetted it fully and done a legitimate, well-intentioned assessment of what the risks or rewards are. So that's my long-winded answer. I hope I answered the question that you were
I
asking.
think it was perfect. I think it was
I know
perfect.
I went a little askew. So
Yeah,
that
no,
was
I'll
great.
also just add some color and context, and then I'm sure Brian can ask the next question. But when we're talking about compliance in healthcare specifically, right? And just say, as I'm wearing kind of the compliance officer hat here in the room, we're talking HIPAA, we're talking high tech, we're talking high trust. Then there is some FDA regulation as well. So those are generally based on NIST standards, right? So there is already a good amount of government involvement in terms of regulatory background for healthcare specifically. It's funny, I actually didn't want to pursue a career in healthcare because I didn't like how regulated it was. I felt that way about finance and healthcare, and now I represent clients in both, unfortunately for me. So, it's one of those
Specifically
things.
because of the compliance and the regulations.
Yeah, also because I'm angry a lot. And I'm generally like I represent small companies, right? So I represent Jon, really the vendors that are trying to pitch to the big fish to like, help them look like they know what they're doing when, they're like trying to figure it out and it's chaotic and it's terrifying sometimes. I mean, the things that I see on a regular basis, I'm like, whoa. So I hear you because I'm on the internal, like lean, scrappy startup that's trying to win the big fish, is trying to get the hospital system, is trying to be like, this is our Hail Mary, like they're the biggest one. And then I'm like, oh, wow. Okay, we can't do X, Y, and Z on this one. So I will just say, like, I wanted to just build that out from a compliance perspective, right? Like the AI issue that we're all having industry-wide is terrifying because even some of the most regulated industries, such as finance and healthcare, cannot keep up.
Yeah.
And they're also like, whoops, and now we're talking breaches of such terrifying information, and also in ways that we could have never fathomed that, right? Like, again, like I talk to startups that are literally like, oh yeah, like we want to now be using like camera recordings that we're going to be actually videoing the entire operating room, and we're going to be using AI tooling. And okay, we're all used to there being like surveillance on a regular basis. We've all pretty much agreed to being like, yeah, there's CCTV monitoring everywhere. We're pretty common on that. Like we're all on camera. But now an AI agent is processing that information, and that's very different because like now it's not a human in the loop. It's technology is actually the one processing the data, and it's going to be a lot easier for it to be like, whoops, like oopsies. And then there's not enough humans that are willing to just stand up and be like, hi, this is terrifying. And if they are, a lot of them might not have those jobs anymore. So that's what I'm going to say. And then Brian, I'm going to get off my soapbox too. I'll rant with you, Jon.
That's an awesome rant. I'm all in.
Yeah. Same here. I'm noticing an interesting trend through all that and going back to the previous episode that we did together around the FDA's role in all of this. So, Jon, you talked about where we kind of started the conversation last time was around vendors claiming they couldn't do a certain thing because the FDA wasn't allowing them, and you calling BS on that. And now we've got this AI space, and I'm sure it applies in other places, and I'm positive it's not limited to just AI, but a group of vendors coming in and saying, well, the FDA didn't say we can't, so we're going to go do this. Both of them trying to, at some level, hide behind the FDA. Like, we're going to keep doing this until the FDA tells us otherwise. While others are saying, well, the FDA is telling us we can't do this, so we're not going to do this thing. It's an interesting juxtaposition, in my opinion, there. And I'm curious from your perspective, having to make decisions around those. You already talked about, I can go read those same regulations and I can, declare BS on that. So obviously that's a tool that you use, but I wonder if there are any others, that any other approaches, any other ways that you deal with that, any other tools that you utilize to essentially check these vendors when they tell you things that they're being regulated to do or not to do, or any of those types of things.
Yeah. So I'm actually going to go back to the relationship card on this one because, and really it works out. So our CISO, our CISO in title has an associate CISO that runs the cybersecurity division, and we're tight, not just as colleagues, but as friends. And we have conversations, and we have open conversations about what does risk look like for the hospital system, but in particular, what does that look like for our patients? And because we're frequently talking about this, fireside chats, whatever you want to call it, and we know where our alignment is, I can push back, and I do push back from an infrastructure perspective, just, looking at the engineering of it, listing our concerns. But I partner very tightly with my counterpart, my colleague on the security side, because he's done all the work of building the relationships through the executive layer and the board of directors. So if I need to bring a heavy hammer to the table, and because he and I are in such alignment, if I see a problem, he sees the problem. If he sees a problem, I see the problem. And we work in conjunction, and we attack it both ways. Myself and my group will go at from a technical perspective. We will challenge the narrative. We will challenge the vendor, make it uncomfortable. But from a compliance and security and policy perspective, my colleague is the one that will say, you know what? Not only do we agree with infrastructure, but here are all the things that we have concerns about, and we are going to voice strongly that we pump the brakes hard. And what we will do is we will basically jointly advocate in parallel our concerns and do everything we can to stop the proliferation of bad technology or additional risk. Now, again, the decision ultimately might be to overrule that, but then we transfer that risk to the people that want to. And it's not an attempt to do like our hands are clean. It's we still care about this. We still think it's a problem, but ultimately the people that are tagged to speak for the organization and make those decisions at a strategic level are now owning that decision. So we're recording our dissent. In a lot of cases, we can drive them to a pivot because our arguments are sound, or we believe they're sound and they agree. But if they choose for business reasons to say, from an interest balancing perspective, we still think the risk is acceptable, we'll accept it. We'll document the concern. We'll actively mitigate where we can, and we'll move on.
Yeah, I think what you said is such an important part of the conversation when we're talking about securing systems and securing, ideally, again, we're focusing on healthcare today, but when we're talking about, like, I get so excited and like glad when I am working with teams that are like in sync, and it's not like compliance versus security, or it's not infrastructure IT versus secure. Like when the teams are in lockstep and they're like in harmony and they're like, hey, and again, sometimes those teams will, be like, hey, this, I have this as a medium risk. You have it flagged as a high. Like what, why? And there should be a little bit of variance, but the best companies that I've seen from a security and compliance perspective are the ones where they have individual stakeholders who are very passionate about what their teams are working on, and they value the other team as like a respectable party of being like, hey, compliance is going to be doing compliance and they're going to be dealing with the FDA and the regulators, and we don't want to deal with that stuff. They're going to be the front face of the auditors. Like most people don't want to do that. The compliance officers are the one to be like, bring it. Like I want to be an audit versus security is like, I don't want to be stuck in audit. I want to be very much focused on actually securing the systems, doing the system hardening. And, infrastructure also is making sure that all of these things are actually working together. And to me, those things are magic when they work together. So it's like been really nice to hear you be like, hey, that's the system. I'm like, man, that sounds great. Like that's like these days. Cause usually like I get the opposite, right? When I'm wearing my compliance hat as opposed to security or IT, people are like, ugh, like, like it's like, oh, here comes compliance. And on top of that, I happen to be a lawyer. So they're like, oh, great. Now legal's in the room as well. Like that's not my reality usually. So it's refreshing to hear it. Cause my guess is y'all are probably doing things best in class because you guys are respecting your individual fields and it's a team sport. We can all agree security is a team sport. At that point,
100%.
if we're saying it's not anymore, we are so far behind.
You're spitting gospel, and I think I think a lot of it when I look back over my career and the people that I've considered mentors and champions of doing things the right way. The term leader is one of the most abused terms in business. If a person's a manager, they call themselves a leader. Are you though?
Yeah.
But when you've had the opportunity to learn and observe from legitimate leaders, you understand that it is all a team sport, and we are far stronger together than we are siloed. And it's worth reaching across the aisle and building relationships and having robust friction driven conversations to get us to what the truth and what good and proper looks like. I mentioned in the first episode we did when I kind of sadly acknowledged that I've had a almost 29-year career. God, I hate saying that out loud. It just, anyway, but I've been very fortunate to work in organizations led by or work directly for people that preached those lessons and drilled it into our heads repeatedly. Because sometimes the popular thing isn't necessarily the right thing, but if you do the right thing, you'll never regret it.
Yeah. No, I love that philosophy because it served me well for pretty much the same amount of time in my career. So, um, curious as you go through these machinations, compliance comes in, does their thing, you're working closely with them. So really there's probably not a lot of surprises that you come across. We've talked about kind of on the before you acquire some sort of tool side of it. I'm wondering if on the back end, like a third party auditor comes in that maybe you don't have as good a relationship with, or that, they always bring different perspectives at things. Or maybe you just miss something, which of course happens because we're all human. Um, I guess what's your guys' process around that? How do you deal with, oh, we've got this hole in our wall that we need to figure out how to plug it? Is it everyone's running around hair on fire? Do you have a well-established plan for that? Is there um, a good, well-known way of addressing that? And particularly kind of, I'm mostly probably more interested in the policy itself, is just how the teams react with one another.
Yeah. So that is something that has happened, right? Yeah, it absolutely has happened. We're very good organizationally. We do rely heavy on third party audits, and it's exactly that thing. Is we need people to come in and see past our biases and find the things that we might overlook, or maybe we don't consider as high a priority, or you know, pick one,
Oh,
pick the
so you're
excuse.
using audits to actually improve rather than just tick a box?
Absolutely,
What a
yeah,
wild
shocking,
idea.
right? Again, I'm the old guy in the room. People are
John,
just
you and
like,
I are going to be really great friends after this. I'm so happy. I'm so happy we met.
Well, it's funny. If 20 years ago, arrogance would have been like, pardon my French, my shit don't stink. We've got it working. It's on lock. You don't know what the hell you're talking about. Fast forward to now and over the years and learning lessons the hard way. And not just me, but organizationally, all the way from our most junior engineer to our most principal, our senior slash principal engineers, it really is not about ego. Ego stops at the door. And maybe it's because of the industry that we've chosen, actually, that's an incorrect statement. The
Yeah.
industry that chose us. I'd like to, I'd like to sidebar on that because I do think there's an interesting story to tell there. But we want to be the best at our craft. We want to be the best at what we do. If we are, our patients are going to get that elite support and care that we want to be here for. So getting the feedback and telling us where we're failing or where we're not right is refreshing. So we go through an audit, we get a list of things, low, medium, high. What we do as a team, we get together with our security teams, the rest of our infrastructure teams. We go through the list. Here are the highest priorities. Okay, what are the steps we need to do to mitigate these? Who wants to own it? You got it. Who do you need to support this to make this right? Let's put some dates on it. Let's meet again and let's celebrate the wins as we knock these off the list. And that is something that we've consistently done. This was happening even before I got here. So if you look at the organizational mindset and you look at the culture of both the employees and the managers within infrastructure, the culture between those two groups was, we want to be better. We want to hit a superior level to ensure superior care. And what I said about the story, and I'll try to tell this one really quick. We were making a very significant change from a platform perspective. Our health system that we use required a certain hypervisor. We were getting ready to implement something that hadn't been implemented at our scale before. I pulled a bunch of engineers in the room, and the first question I asked was, of each person, I want to go around the room. Tell me why you wanted to come to healthcare. Why did you want to work in the hospital system? Every single person started relating a story where a family member was sick and had been cared for and saved by a doctor, or treated exceptionally well and saved by a nurse. By the fourth person, the theme was well established. And what was very clear to me in that room at that time is that none of us had chosen to work in healthcare. Healthcare had chosen us. And it was our responsibility to give back at that moment and pay a debt. Like
Wow.
I know why I came. And for
Oh,
me,
man.
there is a debt that I want to pay. And maybe I've paid it, maybe I haven't, but I'm not done. You know what I mean?
Yeah.
Yeah. I love that.
But
Oh, man, I
but
have chills.
everybody, yeah. Yeah,
I
but
love that.
everyone was passionate about it.
Yeah.
And it was like in 2021 for me, and again, I apologize, but sorry, you're gonna get the sidebar because I'm random.
Do it.
Um, yeah, so 2020, we all know what happened in 2020. The world sort of took a break, um, and I was one of the guinea pigs for one of the vaccine. And I say guinea pig not in a bad way.
Yeah.
I signed up for it because I'm an
You were a
IT
beta
guy.
tester.
Yeah, I'm an IT guy. You eat your own dog food. That's what you do. And eat your own dog food from Rick Devenuti, our CIO at Microsoft back in the day. Incredible man, gold standard. But he was like, you've got to be willing to do this to make products better for other people. And, middle-aged guy, I'm like, yeah, you know what? I'm average. Take my blood. Let's see what we can do. But I was going through that process and recording the results. And my stepfather was admitted to the hospital with severe COVID related symptoms. 3 days later, my mother was.
Hmm.
And my mother's the last remaining parent that I have. And I'm a mama's boy. So the world kind of rises and sets with mom.
Respect.
So yeah, so my older brother and I were, kind of scurrying, trying to get everything aligned, kind of hoping. And my mother, her husband, my stepfather, was in a bad way. Like
Hmm.
a day or two away from an event wasn't really a good sign. And my mom was just coming apart at the seams from this. But this hospitalist where she was not on her floor. He was on the critical floor and she was on the you're going to get better floor. He would come down every 12 hours and
Wow.
give my mother an update as to what they were doing to help her husband. And, fast forward, mom's released. She's doing better. Her husband's still in the hospital. He was in the hospital for 2 months.
Wow.
He did eventually turn a corner and get better. They are at home. They're doing
Awesome.
well. Everything's great.
Thank
But it
goodness.
was this hospitalist who had just moved to the region, who every 12 hours without fail was coming to my mother and saying, here's what we're doing for your husband. Here's the progress. Here's what's going on. Not only were they treating and providing medical care, but he was feeding her soul and providing her this psychological safety net that she didn't have because we weren't allowed into the hospital.
Right.
Yeah.
And so for me, after that, I was like, you give me my mom back? Okay. Healthcare,
I'm
whether or not
committed.
you're ready for me, I'm coming. And we're going to find ways to make things better. We're going to save you money. We're going to bring in better tools. We're going to provide you everything you need because I have this whole bunch of experience that I can apply here that maybe you're not used to, and it's going to scare the hell out of you a little bit. But we're going to bring all the tools to bear to make this environment better for all of your patients and your providers. And
Amazing.
so in 2021, that's what brought me to hospital system.
Fantastic.
And I've done some cool stuff. I mean, I've had one
Good.
of the best careers most people will never know about, but the most satisfying thing to me personally has been supporting the hospitals and going up to a CNO and knowing that she or he is getting what they need because I'm listening to them. They know I'm hearing them and they know that they are my number one priority.
Yeah. Oh, John, I think we
So
could
cool.
probably just keep talking with you for hours and hours, but we will wrap up. So thank you so much again especially for doing a two-part with us. As we do for every other guest that socialized with us at the Security, you're part of the network now. So that's kind of, this is our social network. And, I like to ask a question and it's been interesting how it's changed over the last 2 years. So I will prime it with you and you are allowed to answer however you want. There are no wrong answers here, but a couple of years ago now, I had a CTO tell me that he felt like the fight for privacy was dead. And then now it was only the fight for security. And I would love to hear your reaction to that.
Well, so the non-PC response, the knee-jerk response is, I think that's a stupid take. Um, the more thoughtful take, I think, is I don't think you can differentiate privacy and security. And especially in an era where, as we talked about earlier, with the proliferation of AI and unchecked proliferation of AI, I might add, security is privacy, right? The most important thing that we have is our identity, our data, our personal stuff.
Mhm.
And the way to protect that is to keep it secure and, keep the wolves at bay, so to speak. So I don't think they can be separated. Maybe they could have at a time, but I think the time's been a long time ago. And I don't think, from my perspective, there's any way to do anything other than conflate them two as one issue. So I think standing up for security means protecting people's privacy in whatever form it is. I don't think it can be separated.
Hmm. That's
I love
interesting.
that.
You're almost making the point that there isn't a separate fight, and
Right.
that we need a fight for security because it brings our privacy. That's a unique take on that. After 80 some episodes, you've given us a unique perspective on that, which I love. Man, this has been great. And
Old guy, remember?
yeah, I mean, that's why we love asking that same question, is because there are different perspectives. Everybody's got different experiences that they bring to bear on that. So
I really want to thank you both for not only reaching out, but just taking the time. I've really enjoyed this conversation. Unfortunately, you've had to listen to me more than I feel like anyone should reasonably have to, but I do appreciate the forum, but the dialogue is interesting. And as we've had this conversation, it's forced me to think and articulate thoughts I've had in ways that I haven't really done so for, people I've had the pleasure of meeting fairly recently, or versus the people that are forced to listen to me in my org. So it's easy for me to take that for granted, but I really appreciate I appreciate both of you just taking this time. It's been a
yeah,
very enjoyable conversation.
no, we really appreciate your time, and I think there's a hope that we can do this again at some point. So yeah,
That's
we'll
great.
Yeah, we're
see.
friends now, John. So
We are.
Yeah,
we were compelled by your rant, and Brian always calls his like solo episodes his Brian rants, and then mine are Milou speaks the truth. And so you're welcome to pick either of those flavors and join us again
Uh,
for either of those flavors.
yeah,
That's so awesome.
absolutely. Cool. Well, and we appreciate all of you that have been listening and watching to one or both of these parts. We do this partially for ourselves because we get to meet new people and build a network of really cool people.
Thank you very much.
Okay. Hopefully you all understand now, having watched both parts, ideally, why we decided to do two parts with Jon. There's
He's
there's a
so
lot
cool.
to cover, and I don't think either of us wanted it to end.
Yeah, no, for sure. I hope, like, man, I'm considering him a friend now. So that's the thing, is you got to be careful with us, Brian and I both, because if we're like friends with you, then you're stuck with us pretty much forever. So
Yeah.
he has
Good
that
luck.
to look forward to.
Good luck to you, Jon. Good luck. Yeah, I mean, we've talked a lot about healthcare just this year already. But yeah, it's a big focus for us, to hear those stories about why people on his team are in healthcare, and the story that he told of his personal journey to working for a hospital. Like, yeah, I feel it. I mean,
Chills.
I've got family in the healthcare space, just like you do. Again, I didn't necessarily choose to go down that route, but somehow managed to find myself very adjacent to it, and actually pursuing it, not as a healthcare career itself, but as something that can support healthcare and hopefully do a little bit of good with it. So it's awesome to hear other people's stories like that, if nothing else.
It's Yeah, it's so funny with healthcare because I adamantly like didn't want to go into healthcare. Like it was really an industry vertical that I was like, no, no, that's like my family's past, and like I want to go forge my own path. And so it's ironic that I'm currently getting a lot of outreach specifically for healthcare companies. And again, I think it's exactly what we had talked about really in the first part of our episode, where, in part one, really thinking through like, hey, it's almost impossible for us as like, as a hospital system, as a customer, to be like keeping aware of the rate of change, which, he said something of like technology changes is the constant. And I wrote it down because I thought that was very important from the first part of our like 2-part on this one. And, I also just really, really loved that he had it sounded like he also had a very similar experience to, honestly, all three of us. We're both kind of like those unicorns. We've bounced around industry wide. So
Yeah.
I think between the three of us, we probably hit every single one. So like, I think there's like probably not one that you, John, or myself haven't been like, yep, did that internally and it was a lot. So
Yeah.
it's funny with healthcare because it's a very specific niche group. And so it's an interesting like place to be as the compliance officer, or use the vendor as him as the actual like hospital system. I think it's just like an interesting dynamic. I also just really loved his importance on a human in the room. We're hearing a lot of like there's a human in the loop, right, for like AI, which I continue technology companies continue to surprise me by the fact that there are no humans in the loop anymore, and so they've decided to just full in go on AI, and then mistakes are happening. In healthcare, the mistakes that could happen for that are life or death. And
Yeah.
so I think the gravity of the situation, right, is like if a immature startup does something silly with an AI agent that they're like, whoops, unfortunately for them too, for their customer, the hospital system is probably limited in liability. And to me, I'll say that the anecdote I will keep for John, and I hope he listens because I'm sure he'll get a kick out of this. For me, the thing that brought home the importance of healthcare was I worked in-house at one point, and there was an issue and there was a security incident, and the company I worked for at the time messed up. And I, as the compliance officer, had to go into this virtual room and talk to a doctor and be like, hey, the data's not there. And I was representing compliance and legal and security, and I was wearing all these hats. I had all the information. I was super mad at the team internally. Like, I need to make that really, really clear because somebody made a stupid mistake and they did lose their job for this. But I was the one who had to sit on the call and get yelled at, and also get a doctor who was a individual practitioner who didn't understand that, like, if you have a cloud provider and you need backups, that like you still need a backup to your backup because it happens and sometimes data gets lost. And it was one of the most humbling experiences for me because I really I didn't go to work for like 2 or 3 days after that because this doctor was like, what do you mean? Like, I have to keep my files for 6 years. Like I could lose my license over this. Like, what do you mean somebody just like deleted something and they weren't supposed to? And it was one of the most sobering experiences that I had because I was sitting there being like, I know that I'm representing a company that f***ed up on this one. And like, we tried our best to make it right, but like, we couldn't do enough. We could not do enough because we like just couldn't support that human in what we needed. And it was a very important lesson for me to learn. And again, I did push back. That individual was terminated. That didn't feel good at the time, but it was the best course of action was like, hey, there do have to be really strict consequences, but to have somebody where their compliance requirements require them to keep their meticulous records for 7 years, and for their set of records, not only the original copy, but the backup to just have just been wiped, it was one of the hardest things I've had to do in my career.
Yeah. Yeah. And I mean, just that 6-7 year requirement that healthcare's had for a number of years now has been a big challenge. It's not easy to deal with, and it's not cheap to deal with. And that's one of those.
Well, especially
Like,
even with the rate of change. Like we
yeah.
used to have backup tapes, and then
Yeah.
it was hard drives, and then it was servers, and now it's all cloud based with still like it's like the hardware has like it's probably even like useless at this point. When I still see policies with backup
Yeah.
tapes, I'm like, LOL, who's still using that? Like, but like
Yeah.
also like, why are these still in the policies? It's because somewhere within a hospital system, they probably do still have a backup tape. They do actually
Mhm.
still have those things, and that technology exists probably in some like storage unit, elsewhere. But it's just really important when we're talking about malpractice, and that's kind of where the regulatory compliance background is coming, right? From, that doctor needs to be able to like CYA in the worst case scenario that something happened and, they messed up. And again, that as the person on the compliance side that had to cover for infrastructure and had to cover for engineering and security and be the one to just sit there and just listen and offer the meager things that I could do. It was just a very sobering experience as to why security and compliance matter so much in healthcare. It matters in every industry, y'all. Like, stop like cherry picking industries that it matters that we need to be secure, because like it matters across the board. But like, especially when we're talking about patient data, you know, people lose their licenses for this stuff. They can go to jail for these things. This is not like, oops, my bad. You know, and so it's a serious thing.
Yep. So hopefully everybody enjoyed that. Thank you, Jon, for joining us. We obviously have lots of thoughts, so I suspect we'll touch on these topics again. So stay tuned in for more discussion on security, compliance, and healthcare, and all the things that go along with it. If you want to reach out to us, info@socializingsecurity.com is the best way to get us, or hit us up on LinkedIn.
Yeah. And again, y'all, thank you so much for continuing to socialize with us. Brian and I are both really committed to this and continuing to just try to expand our socializing network. And so we're really grateful for individuals like Jon who, you know, really donate their time to come chat with us and help us, you know, socialize about IT, security, compliance, privacy, legal, whatever under the sun, at an understandable level. And so again, if you know anyone, refer them in. If you like us, subscribe, like, follow, share, repost. That's the only way that we're going to continue to grow our platform organically.
Yep. We don't request that as often as we probably should, but
5 stars.
that does help a lot.
You can be honest. You can be honest. We can take that.
Yeah.
We're grateful.
Cool. Well, take care, everybody, and we'll talk to you on the next episode. Thank you for joining us for another episode of Socializing Security. We hope you learned a thing or two with us.
If you'd like to continue socializing with us on this topic or have feedback, we'd love to hear from you on LinkedIn or social media. Just search for Socializing Security. Or you can email us at info@socializingsecurity.com.
Until next time, stay social and stay secure.